Welcome to Center for Obesity and Metabolism. As the first step in our program, our team of medical experts has created this online seminar to help you fully understand the specific surgical options available at our center. So whether you are just beginning a weight loss journey or have experienced other programs before, this seminar will provide the resources necessary to make an informed decision about whether weight loss surgery is the best option for your individual needs. During this seminar, we will discuss obesity as a disease. We will explore the causes and many of the symptoms associated with obesity and metabolic disorders. We will explain treatment options, including both surgical and non-surgical choices for patients diagnosed with obesity. We will also explore how these options can improve many of the symptoms you may be experiencing. Because each diagnosis is unique, it's important to understand the variety of treatments and procedures available. We will specifically discuss 4 of the advanced surgical options available at GR Health, along with the short and long-term effects bariatric surgery may have on your life. Finally, we will explore the comprehensive program steps at Georgia Regent Center for Obesity and Metabolism. We are partners with our patients throughout each treatment process. Our fully integrated program gives our patients the tools necessary to have a healthier life for years to come. We will introduce you to our team of bariatric specialists, share some of our outstanding program features, and explain what you can expect as a patient at GR Health. To begin, let's define obesity. As with any medical condition, in order for treatment to be successful, we must first understand the condition and how it impacts the overall health of each patient. Obesity is generally diagnosed by calculating a person's body mass index, or BMI. This index calculates how much a person should weigh proportionate to their height and gives physicians a general idea of their overall health. Using a person's BMI, we can calculate their amount of excess body weight as a guide to create healthy weight loss goals. For example, if a patient of average height around 5'6" and medium build weighs 350 pounds, the physician can calculate that this patient's BMI is 56.5. Because a healthier body weight for a person of this height is closer to 150 pounds, the physician can then determine that this patient would be at a healthier weight by losing approximately 200 pounds. Using this chart, we can determine healthy ranges or identify weight ranges that elevate health risks. While a BMI of 18.5 to 24.9 is within the ideal weight range, patients with a BMI of 25 to 29.9 are considered overweight. At a BMI of 30 and above, patients are considered obese and have a higher risk of several chronic diseases. Because patients with a body mass index of 40 or higher experience significant health complications and are at higher risk for potentially life-threatening chronic disease, they are considered morbidly obese. Physicians may also call this medically severe obesity. In the United States, bariatric surgery becomes an option for weight loss at a BMI of approximately 35 to 40, depending on the presence of related diseases. These patients are generally 100 pounds or more over their ideal body weight. The American Medical Association officially recognized obesity as a disease in 2014. It is important to keep in mind that as a disease, obesity is not simply the outward appearance of excess body weight, but is a health condition that can drive other serious health issues. These chronic diseases are often experienced by patients with medically severe or morbid obesity. These diseases can affect every system within the body. In addition to being life-threatening, these diseases can affect and interact with each other, such as sleep apnea and cardiovascular disease. While some conditions like joint or gynecological disorders are not life-threatening, they may still greatly affect a patient's overall quality of life. Understanding obesity as a disease can be difficult. There are distinct symptoms experienced by patients with medically significant obesity because they often experience more than one of the chronic conditions associated with obesity. They may fatigue easily, which may affect work performance or limit normal activities of everyday life. Socially, a morbidly obese person may feel less comfortable in social settings. These medical and social factors can leave a person feeling uncomfortable, even in private. This map of the United States depicts the percentage of people in each state who have Class 1 obesity or above, according to the Centers for Disease Control and Prevention. While the highest percentages of obesity are concentrated to the southern and midwestern states, it is important to note that every state in the country has experienced an increase in the number of obese residents by approximately 10 to 15% in the past 20 years. The CDC reports that currently 35.7% of adults and 16.9% of children in the United States are obese, which equates to more than 90 million people across the country. Because these people suffer from chronic disease at a higher rate, annual U.S. medical costs from obesity have increased to more than $147 billion. Obesity is currently the second most preventable cause of death and is on track to be the top cause in the near future. Looking specifically at the Georgia and South Carolina region, we can see that obesity is becoming more prevalent in children. Kids are more at risk for becoming obese when they have obese parents, so health trends in children often mirror what we see in adults. Most diseases can be attributed to a combination of causes, and obesity is no different. The exact combination of contributing factors to obesity can be as unique as each patient. Because your treatment depends on effectively identifying and addressing the causes of your disease, it is important to take a step back and objectively understand and acknowledge what causes may affect you. One cause can be traced through our genetic makeup. Thousands of years ago, when food was scarce, the ability to gain weight quickly was an important survival trait. Our hunter-gatherer ancestors evolved to have incredibly efficient systems that could provide the body with energy for a longer period of time. Of course, in modern times, rather than higher chances of survival, descendants of those with this trait now experience difficulty with weight gain. The evolutionary trait is embedded in our DNA, and we now recognize that there is a clear difference in the way some people process calories that may be affected by the genes that regulate appetite. Another common cause of obesity can be attributed to a psychosocial element. According to the National Institutes of Health, people with obesity are at a 40 to 60% higher risk of also having a behavioral disorder like depression or anxiety. Depression and high levels of stress can cause changes in the endocrine system, which affects the body's metabolism. When children experience bullying or adults experience social prejudices due to their physical appearance, it can be a catalyst leading to depression and anxiety. Oftentimes, these people will compensate for the lack of endorphins and hormones generally created by the endocrine and metabolic system by consuming calorie-dense foods. Finally, obesity can be greatly affected by the environment you experience every day. In the United States especially, food portions have become larger, while access to healthy, nutritionally rich foods may be limited or cost prohibitive. We are constantly immersed in a culture where meal options often contain more than a day's worth of calories in a single serving. In an environment where meals need to be convenient and affordable, finding a steady source of healthy meal options is a real challenge. As we discuss obesity treatments, it's important to remember that there is not any one cure for obesity. This is a chronic disease, which means that effective treatment must include a lifelong combination of techniques. Among these are non-surgical methods like diet and exercise, or medically supervised weight loss programs and medication. There are also surgical methods, like the ones offered at GR Health. Many weight loss programs concentrate their efforts on only one of these treatment methods. While this approach may provide some initial results, it simply is not an effective method of lifelong treatment of obesity. As seen in this chart, patients who lose weight on a single method plan see results throughout treatment but return to their original weight within 5 years. Patients who undergo surgical weight loss are more likely to maintain their weight for long term. But patients who combine these two methods have the highest level of success. The diet and exercise category has become more than just a weight loss strategy, it's a big business industry. When starting a diet and exercise plan, it's important to know which products are useful and which are not, so you don't waste your money. We can help identify many books that are a great resource for a cost-effective starting point for weight loss. Credible programs will always acknowledge that progress is a lifelong commitment, not a quick fix. GR Health encourages our patients to experiment with credible diet and exercise methods to find the one that best meets their needs. Proven products or methods should have a good track record of gradual, long-term changes with reliable results, and that are verified by a third party like the American Medical Association. Resources like Weight Watchers and Volumetrics use practical advice based on medically accepted methods of weight loss that are supported by years of positive results. When looking for a source of good information, try to find something based in scientific fact, supported by an accredited organization, like Mindless Eating. In this book, a nutrition and psychological research expert was funded by the National Institutes of Health to discover the psychological reasons behind overeating. There are also books and products that take advantage of people trying to get healthy. It's important to keep in mind that the ultimate goal of weight loss books and products is to earn money. That means there are many books that make fantastic claims designed to sell, but provide very little substantive information. Before investing your time and money into a product, do a little research into the author. Remember that obesity is a chronic disease, meaning that there is no magic or quick solution, but one that needs medically based advice for long-term success. In reality, very strict diet and exercise plans are a daily challenge, and the results are often very disappointing. In a study from Boston Tufts University, patients with Class 1 obesity or greater were assigned a diet and their progress was tracked for a year. More than 40% of those assigned to the restrictive Atkins diet quit because the lifestyle was unrealistic. However, even when following a less restrictive diet plan like Weight Watchers, participants had under 10 pounds of weight loss. These diet plans are a great starting place to increase health, but when results are minor, it can be easy to become discouraged and restart the cycle of weight gain. This chart is from a newer study that also followed weight loss patients. These patients were broken up into 3 groups: those who only changed their diet, those who made small lifestyle changes as directed by a physician, and those who did both. While the patients who experienced a combination of treatment methods initially lost more weight and were able to sustain the weight loss for a longer amount of time, all the patients regained every bit of weight back within 5 years of the program. This is because while diet and behavioral changes may address some of the psychosocial and environmental causes of obesity, it does nothing to address genetic and other causes. Without addressing every cause comprehensively, sustained weight loss is very difficult. Weight loss medications are popular around the country. You may have seen an increase in medical weight loss clinics in your neighborhood that promote the use of medication to encourage weight loss. While some drugs do help regulate hormones, most do not cause significant weight loss, and many have serious side effects. While other weight loss medications may be safer alternatives, the amount of weight patients lose on these drugs is minimal compared to the side effects and the cost of the medication. If you have not found long-term success with any of these weight loss techniques, we will now explain surgical options. Weight loss surgery is now safer and more efficient than ever before, with access to laparoscopic and robotic surgery. There are 4 major types of weight loss surgery: gastric bypass, sleeve gastrectomy, gastric banding or lap band, and biliopancreatic diversion with duodenal switch. Each surgical technique provides a different experience and outcome, but is matched with the unique lifestyles of our patients. After this brief overview of each surgery that we provide, we encourage you to discuss the pros and cons of each with your physician to determine which is the best fit for your specific needs. Basically, weight loss surgery is either bypass or non-bypass. The most popular bypass surgery, and one commonly performed at GR Health, is known as a Roux-en-Y bypass. Although the procedure was first performed in 1966, major advancements in the past 10 years have made this surgery more safe and effective than ever before. During a Roux-en-Y bypass surgery, the surgeon divides the second part of the small intestine and brings the downstream segment up and attaches it to a small 1 to 2 ounce pouch created from the top of the stomach. The upstream end of the divided bowel is then sewn to the side of the downstream end, creating the Y configuration. The majority of the stomach remains in place, but it and the first part of the small intestine are bypassed as food transits through the esophagus into the pouch and then directly into the second part of the small intestine. The digestive enzymes in the bile and pancreatic fluid continue to flow into the first part of the small intestine, but now do not mix with food until well down into the second portion of the small intestine. The Roux-en-Y gastric bypass does restrict the ability to eat very much at one time, and it does lead to some degree of malabsorption, but only for the few nutrients that require the activity of the stomach and first part of the small bowel for absorption, such as iron, calcium, and vitamin B12. What appears to be the main cause of weight loss after this surgery is the dramatic change in hormones produced in the stomach and intestine. This shifts the hormone drive from one of hunger to one of fullness, helping the patient to stick to a healthy diet. The Roux-en-Y gastric bypass surgery is one of the most commonly performed procedures in the United States and is now available with laparoscopic or minimally invasive options. Patients can expect to lose 60 to 75% of their excess body weight during the short term and maintain that weight loss over a long period of time. This surgery has a relatively low complication rate, and the patient can take preventative steps to drastically reduce their risk of post-surgical complications. This graph depicts the projected weight loss patterns of a patient who undergoes gastric bypass surgery. As with any weight loss method, after the initial weight loss, we can expect to see a slight weight regain. However, even as far out as 14 years, patients were able to keep their weight stable with more than 50% of excess weight lost. Because the Roux-en-Y procedure has been around for over 4 decades, there are many scientifically valid studies that verify this procedure's merits. Different studies by several teams of researchers were able to confirm positive results as many as 20 years post-surgery. Those studies found that when patients followed up with their physicians as recommended 1 to 2 times a year after surgery, they maintained weight loss and a healthy lifestyle for the long term. It is important to keep in mind that the number on the scale is just one result of bariatric surgery. The Roux-en-Y procedure leads to a healthier patient overall. In fact, patients around the world are able to reduce the incidence of obesity-related disease by a significant amount. For example, all patients improved their diabetic condition, but 86% of patients were able to completely stop taking their diabetic medication altogether. Similar results were found in patients who previously suffered from hypertension, hyperlipidemia, and sleep apnea. Our physicians work with the patient's cardiologists and other specialists to ensure a safe transition when adjusting or eliminating medications. As with all surgical procedures, there can be risks. Fortunately, many of the complication risks common in open surgery have been eliminated with the adoption of minimally invasive and robotic surgery. Reshaping the intestines is a specialized skill, and surgeons must have the expertise to create a tight, well-sealed connection to prevent any leaks, as they are dangerous and can create complications. While the national average for surgical leaks is a very small margin of 1 to 4%, only 0.2% of patients experience leak-related complications at GR Health. Our program incorporates preparations and procedures before, during, and after surgery to decrease the main risks to leaks. That's why our outcomes are stronger than the national average. We work with each patient to monitor progress and ensure the complication risk is minimized, even after discharge from the hospital. The most common side effects of surgery are dehydration and nausea, which are easily treatable. It takes time to adjust to the new levels of hunger hormone, meaning many patients forget to eat or hydrate and may become dehydrated. Because the new pouch bypasses the stomach, patients can also experience deficiencies of micronutrients like iron, B12, calcium, and vitamin D. Our dietitians check these levels before and after surgery and at regular intervals, prescribing over-the-counter supplements when necessary. Due to the advancements made in perfecting the Roux-en-Y procedure over the past decade, the risk of major complications are now no greater than with a routine gallbladder operation. The next surgical option is called a sleeve gastrectomy. During this procedure, the surgeon removes approximately 2/3 of the stomach to create a banana-shaped pouch. No bypass is involved, but because surgeons remove most of the upper portion of the stomach where hunger hormones are produced, appetite hormones are restricted, similar to gastric bypass surgery. Sleeve gastrectomy is the second most popular surgery among bariatric patients and is an ideal option for high-risk patients or those with cardiovascular issues. The sleeve gastrectomy can be performed in succession with a bypass surgery, meaning that surgeons can perform this surgery to allow patients to achieve the weight loss needed to qualify for a bypass surgery. The short surgery time means that there are fewer complications and a faster recovery time. Patients also have a lower rate of ulcers and bowel obstructions than in other surgeries. Those who undergo a sleeve gastrectomy still experience the full benefits of a bariatric surgery, including reduced rates of diabetes, hypertension, hyperlipidemia, and sleep apnea by more than 70% in most cases. Because sleeve gastrectomy and Roux-en-Y bypass are both minimally invasive procedures, there is generally no difference in the number and length of incisions. Similarly, because both procedures involve significant changes to the stomach, nausea and dehydration risk is similar. Although the high pressure of the new pouch can worsen or cause heartburn, the Center for Obesity and Metabolism at GR Health is currently developing a new surgical method that allows a sleeve gastrectomy without these side effects. As with all bariatric surgeries, the success largely depends on whether or not the patient follows up with their physician on a regular basis. Patients who visit their doctor once or twice annually after surgery generally see a lower complication rate and a higher rate of success with weight loss and the elimination of obesity-related diseases. Although excess body weight loss was lower than other surgeries, patients were able to replicate similar results in reducing other diseases like diabetes and sleep apnea. Additionally, because this is a relatively new procedure compared to the Roux-en-Y bypass surgery, there are few long-term studies to verify the long-term expectations. The third surgery we'll discuss today is the adjustable gastric band surgery, or lap band surgery. Although this procedure was initially developed through the 1980s and 90s, the FDA approved the unique device for the procedure in 2001. The actual adjustable gastric band is a silicone device with inflatable tubing and a port that allows the band to be adjusted after the procedure. During a lap band surgery, the surgeon places the band around the top of the stomach, establishing a small stomach pouch generally around the same size as those in gastric bypass surgery. The port is then attached underneath the skin. The patient returns to the physician office to have sterile fluid inserted into the tubing. This inflates the band and gradually restricts food intake over time. This procedure is the fastest and most simple procedure for surgeons to perform, so it is also the most affordable to cash-paying patients. It also has a lower risk of initial complications than other gastric surgery. However, lap band surgery also requires the most follow-up from the patient. While it has the lowest risk after surgery, it has the highest rate of long-term complication. This is mainly because this surgery is the only gastric procedure that introduces a foreign object into the body. 45% of patients require additional surgery within 10 years of having the lap band surgery. Although long-term lap band patients see weight loss comparable to other surgeries, the initial weight loss is not as high. Because the stomach remains intact, hunger hormones do not decrease, requiring more discipline from the patient. Patients with the adjustable gastric band lose weight very gradually, meaning that it may take 3 years or more to achieve weight loss goals and improve overall health. This procedure is best suited for young, active patients with no other pre-existing conditions. This surgery requires the most frequent follow-up care, generally an appointment every 4 to 6 weeks to adjust the band and ensure the band is properly placed. The final surgery we practice at GR Health is the biliopancreatic diversion with a duodenal switch. This surgery is highly specialized to benefit those with extreme obesity or with severe diabetes. Currently, only 5% of patients qualify for this surgery. First performed in 1979, the BDDS procedure employs both a sleeve and a technique similar to the Roux-en-Y bypass surgery. The complication for this surgery is higher than other procedures short-term, although this is most generally because of the risks attributed to the patient's coexisting diseases at the time of surgery. The more extreme nature of this procedure results in a dramatic change in appetite hormones, stomach reduction, and absorption in vitamins, minerals, and even major nutrients such as proteins and fats. Combined, these factors create significant initial weight loss of 70 to 80% of excess body weight. The patients who undergo this procedure are generally severely affected by conditions like diabetes, hypertension, high cholesterol, and sleep apnea. This is because the rate of improvement in these comorbid illnesses is the highest of any bariatric procedure, thereby offsetting the higher risk of the procedure. Because it is a longer and more specialized operation, patients will have a longer hospital stay and will be at a higher risk for complications. The benefits to minimally invasive or robotic surgery are significant, including smaller incisions, less pain, lower risk of infection, lower risk of hernia formation, less internal scar tissue, shorter hospital stay, and faster recovery. At GR Health, we offer the Da Vinci surgical system for robotic assistance for laparoscopic surgery. In addition to minimally invasive, robotic surgery benefits include possibly less pain, improved functionality of instruments, and better three-dimensional views. At the Center for Obesity and Metabolism at GR Health, our program offers a holistic, patient-centered program that addresses individual patient needs. In addition, we provide specially equipped ORs, hospital rooms, radiographic equipment, waiting areas, and restrooms. We help our patients achieve long-term success by guiding them every step of the way. Our expert team includes fellowship-trained surgeons available 24 hours a day, 365 days a year, program coordinator, nutrition experts, psychologists, nursing specialists, dedicated cardiology, radiology, and anesthesiology clinical team members, and operating room coordinator and nursing staff. Our surgeons are fellowship trained and board certified with expertise in bariatric surgery, minimally invasive surgery, and single incision laparoscopic surgery. With extensive experience in metabolic effects of bariatric surgery and a research focus on the mechanisms of diabetes and improvements after bariatric surgery, our surgical team is focused on improved outcomes and the long-term success of our patients. All members of our clinical team have experience in managing patients that have additional risks due to obesity. Understanding those risks and knowing how to manage the overall health of each patient is what sets our team apart. We have a dedicated bariatric nurse coordinator that will help guide patients through every step of the program, from the initial consultation through all follow-up care. Our team is also very knowledgeable about navigating through the insurance process. Each of our patients has the support of our entire team to answer questions and help with each step of the program. Team members include a physician assistant with extensive experience exclusively with bariatric surgery, who works primarily in the clinic with pre- and post-operative care, a registered dietitian for customized nutritional support, a clinical psychologist with extensive experience in obesity surgery and eating disorders, dedicated cardiologists with bariatric surgery expertise for disease management and careful cardiovascular monitoring, and an operating room staff with a high volume level of academic medical center experience for specialized surgery and bariatric surgery expertise. So what can you expect from our program? First, you will have an initial clinic appointment where we will discuss your medical history, provide a physical exam, discuss surgical options, and talk with our dietitian and clinical psychologist. These are requirements of the program. In addition, we will schedule lab work and any necessary tests. Next, our team will help you understand the insurance requirements and how to manage through the process of pre-approval. We can also discuss self-pay options and can schedule treatment once your testing and medical clearance is completed. Following pre-approval, we will then schedule a pre-operative visit. Remember, our bariatric nurse coordinator will help you manage each step of the process, and our team is available to answer all of your questions as you go through the program. You will most likely only spend 1 to 3 days in the hospital, and after surgery, you will be on a liquid diet for the first few weeks. Follow-up clinical visits will be scheduled at 1 to 3 weeks, 4 weeks, 3 months, 6 months, 9 months, 12 months, and then yearly. We hope you have found this information helpful. Our team of experts is happy to answer any questions that you may have after viewing this online seminar. We are conveniently located at the Georgia Regents Medical Center, and for more information about weight loss treatment options at the Center for Obesity and Metabolism, please call our coordinator at 706-721-2609. We look forward to helping you reach your goals for better health.